hey, all of those in lockdown, which is almost everybody. I had a great conversation yesterday with Dr. Willem Venter from Breda Med.
So if you want to save lives, we can prepare all we want in hospitals. But if people don't do social distancing, people will die. Or you need to be one of the unlucky few people that walks past someone and right at that moment they spit into your mouth.
There's a couple of things before you watch this that you need to know. First is that it is a long format podcast. So it's not short, it's not advertising, it's really a discussion on the different things connected to COVID-19 and our community. Second thing is you might know a lot of this information because a lot of it is in the news. And I think this format is really to clear up some misunderstandings. Number three is I need you to comment down below what else you would like to know. We've realized that we cannot deal with all the questions in one go. And it's a great discussion, but we want to get some good information. So this one is a very informative type podcast that gets us good information. But maybe you can comment down below and also tag people in your comment or share this with someone that we can really build a community of information as we go through interviewing different people within our community. And how COVID-19 is affecting them, their business, their community, their family, and how they're responding to this. So look forward to it and enjoy. Hi, Dr. Venter. Thank you so much for joining us this morning. How are you doing under these crazy circumstances of COVID-19?
Hi, Mone. Yeah, thanks for inviting me. We're actually doing okay. I think at this stage, it kind of feels like a bit of a quiet before a storm, and we don't know, what category storm is coming. But at this stage, everybody's keeping up and just a little bit, kind of anticipating, not knowing what's coming.
This week I was reading on the SA coronavirus website. They were sort of describing if you've got symptoms of the coronavirus, and it's things like fever, sore throat, bit of a cough, basically everything you feel when you've normally got the flu. So most of the people I've spoken to, including myself, my own family, we feel we've all got the coronavirus. Everybody I speak to has the coronavirus. So what really would motivate someone to actually follow protocol of phoning the hotlines or systems in place? We're going to deal with that question a little bit later. But how do we know? What are the symptoms of coronavirus?
Well, I mean, you've mentioned the core symptoms, and what we need to understand is it's a virus. It causes a viremia. There's all sorts of non-specific, wide-ranging symptoms, but the main symptoms are a fever above 38 degrees Celsius, a sore throat, and a dry cough specifically so. And then, strangely enough, doesn't give a runny nose or a blocked nose to many people. For those who get really ill, shortness of breath, a really quickly onset shortness of breath. So
if you've got a runny nose, you're in the clear, where you get quite upset of having a runny nose. If you've got a runny nose, should we still phone? Shouldn't we phone? How do people respond? I think everybody's pretty nervous.
At the moment, if you're thinking, I need to get tested for the coronavirus, at the moment, and everything's momentary, everything's changing quickly, but as it is, and it's been for maybe a week or so at least, or since the start of the thing, if you haven't traveled overseas to one of the countries with ongoing transmission, so that's a list that gets updated all the time by the WHO, or you haven't been in contact with a confirmed COVID-19 or coronavirus case, now you would know. If the system works well, which it does most of the time, you would know because somebody would have phoned you and said, hey, you had a braai with Piet last weekend. Piet's tested positive and he's listed you as a contact. If you haven't got one of those two things, then you're unlikely to be tested. I mean, here and there, the rules will be bent for in certain scenarios, but really, they shouldn't. Most of the time, you shouldn't get tested for those things. We see many people with flu-like symptoms and they don't get tested. Could they have been the coronavirus? Unfortunately, the answer is yes, they could have. But at this stage, for various reasons, and I think they're all good reasons, we won't test those people. Because remember, a positive test result isn't going to change what we're going to do. Apart from tracking contacts and so forth, we're going to isolate you. So if you're ill, isolate yourself. That's it. Yeah. You're being treated for coronavirus.
So a big question is, does it stay alive? How long does it stay alive? Is it on wood? Is it not on wood? Is it on metal? Should you disinfect all the bags that you buy at the shops? There's just so many things floating around. So maybe you can give us some tips on how do we get this virus, and then how can we avoid those things?
Okay, so that's a good question, because there is a lot of info out there, but you need to bring it back to the basics if you want to know what to do. So we can go on and on about whether wood or plastic or metal is 3 hours or 5 hours or 2 days. You still need to touch that surface and touch your face to get the virus. So you don't need to worry about, which surface you can touch or can't touch or shouldn't, or, you shouldn't be touching surfaces and touching your face. If you don't do that, you can't catch the virus in the way that it's spread mostly, because this is the way it spreads. A person who's infected and is shedding virus, as we call it, they either by coughing or sneezing or doing that thing where you're chatting to someone and you see a little spit droplet go and goes and sits on their shoulder.
I've heard that's the best way to get rid of people at the moment, is just sort of cough and everybody would leave you. Not that you're allowed to be around people, but that's a great way of getting rid of people.
That's how the virus spreads. By those little droplets, they fly out and they fall onto a surface. We're talking about a diameter of a radius of about 1.5 meters to 2 meters, which is safe, unless you're the verspoegkampioen from Koekenhoop. It might be a bit further, but that's the way it spreads mainly. So it goes and lands onto the surface, and then for X amount of hours, it survives on that surface. And, it's all semantics about how long that is, because we know that's the area we need to attack. We need to not touch surfaces and touch our faces, because there are some people talking about aerosolizing, and aerosolizing means that it goes out and the droplet doesn't go down and falls onto the surface. It stays in the air, hangs around in the air for X amount of time. There's not a lot of clarity on it. Certain medical procedures can have that. So, happening, like using a nebulizer, that's different than me basically making an aerosol of it. But I think for the general public, the way coronavirus spreads is either way you kiss the person, or you touch a surface or the person and then touch your face. And that's it. Then you've got the coronavirus. So that answers the question on how it spreads. General things. If you just walk around your house and just see what you touch, surfaces that you touch that someone else could have touched. Think about doorknobs, just using the toilets and flushing it, counters where you put your hands on, then you kind of rub your eye because there's something in your eye.
My face has never been more itchy than it has been in the last sort of 3 weeks. Maybe it's because I notice it more, but it's just way itchy, and there's never a hand sanitizer anywhere nearby. So you sort of, you weigh up in your mind, or I do personally, should I scratch that itch, or should I scratch it against something, or how do I get rid of that itch? Because I just don't want to touch my face. Yeah. And I'm sure many people feel that way.
So, that's it. And that brings you to the question of, I'm just going to jump into it, masks, right? So many people are on about, should I wear a mask? Should I not? Now, if you have that picture of how the coronavirus spreads in your mind, basically for your mask to stop the coronavirus, a coronavirus infection from one person to the next, first of all, you need to be within like a 1 to 1.5 meter space of that person. Or you need to be busy with some medical procedure, intubating a patient, doing a nebulizer, testing them for the coronavirus. Or you need to be one of the unlucky few people that walks past someone and right at that moment they spit into your mouth. That's basically how a mask is going to save you from getting coronavirus. So that's why masks become redundant. If you're practicing social distancing and you're not in a hospital and you're not a healthcare worker, the only thing a mask actually does is it ensures that you will touch your face. Because put a mask on, Mona, and wear a mask for an hour and see how itchy your face is then. You're constantly adjusting. You're constantly trying to, I've got the mask on. Okay, is it right? No, now you're bothering my glasses. Yeah. So that's why people talk about more risk if you have a mask, is because you're actually ensuring you will touch your face at least twice when you put it on and when you take it off.
If you had the virus yourself, would that help not spread it?
If you have the virus yourself, you shouldn't be walking down the aisle.
Okay, but maybe you don't know you have it.
Um,
Because remember, sometimes it can be non-symptomatic.
If you have the virus yourself, it's a totally different ball game. Okay, so if you've got a confirmed coronavirus patient, then obviously we're stopping the droplets by putting the mask on. So that's a bit of a different ball game. So yeah, it's got an effect there.
Okay. So one of the things that I've seen, and I think the whole country or the whole world is trying to figure out this corona or COVID-19, and we're learning information as time goes on. And some countries in the beginning thought that exposing everybody to COVID-19 would then help everybody build up a resistance towards having the coronavirus. So it was a general sort of idea, let's expose everybody, build up a general immunity against this virus, and then we sort of go forward. Do you think that's an option in South Africa?
It makes me think of, kind of thing you still see in the Platteland when one of the kids, has in the family has chicken pox. Then they bring all the other kids so they can get the chicken pox and get it over with. I don't know if that's ever something that you've heard before.
Yes, definitely.
But yeah, with coronavirus, the idea is this. We talk about flattening the curve, and I think there's some really good information on how that works. But yes, the end game should be that we all have, either via vaccine or via prior infection, have some form of immunity to it. The scary idea is we just don't know when that's going to be or how that's going to work. Until then, the way people die of coronavirus is usually via a respiratory or a cardiac type thing. So your lungs or your heart. So you need intensive care for it. So there's a fairly high percentage, 2 to 5%, you'd read, of people will need intensive care with oxygen, and those that are really unwell, ventilators, so a machine that takes over your breathing or helps you breathe. And the problem is, if we have so many people infected, we basically fill out the spaces in hospitals where we can help those people. And that's how you see people dying by the hundreds in some of these countries, is they're totally overrun with cases. What we actually want to try is not for you and your neighbor and your next door neighbor and the guy across the street getting coronavirus at the same time, because we might not have ventilators or oxygen or whatever's going to run out first for all of you at the same time. So that's flattening the curve. Now, depending on the resources in your country, that's how much you'd want to flatten the curve to get under the level of resources that you have.
I think us within our community, within Robertson, the Greater Bearded Valley, and also South Africa, the decisions that we're making currently to either go out or not go out, or follow the rules or follow lockdown, or actually follow the law in the circumstances, will greatly affect how this thing plays out. If people don't take it seriously or people don't respond seriously, there is no way we can flatten the curve, and this lockdown could go longer.
I was thinking about this. There will be a very small subset of people that have their lives saved by clever doctors or a doctor making a great decision in ICU. But most people will actually die or are dying because of resources. It's not because it's a difficult thing to figure out, or, there are technicalities to that, but the saving of lives, it's not doctors who are going to save lives here. It's not clever intensivists. It's going to be people on the street deciding to not go to the shop. You're saving a life. You're literally saving lives by not touching your face. You're saving lives. Maybe not your life, but remember, if you get infected, you can spread it. 80% of people won't have very serious illness. But if you have it and you don't have a serious illness and you're spreading it to your grandmother or someone with chemotherapy, someone with heart disease. So if you want to save lives, we can prepare all we want in hospitals. But if people don't do social distancing, people will die.
We've seen a lot of imagery of people really not taking this serious and going out. Although a vast majority of the population is taking it seriously, there are still groups of people or people out there that feel like this virus does not affect them. So how do you feel? Do you feel like people are actually listening to this lockdown and listening to the president, or do you feel people are not taking it seriously enough?
That's a difficult question. I think there are many people who are taking it quite seriously. and are being quite responsible. I must applaud some people for the effort they're going to. For everyone, it's a bit more difficult to, it's not equally easy to isolate, but there are many people who are quite blasé, and that's, if you have as many doctors friends on Facebook as I have, you see a lot of anger about that, because the doctors see and understand the seriousness of the situation and see people dying, and then they see someone just not, taking, the most basic necessary precautions. That hurts you, because you know what it looks like when someone's dying. So I think, difficult question to answer, but there definitely are people not taking it seriously enough. And that's our valley, our town. You hear the way people are talking. Some people are saying, I'll be okay. Yes, maybe you will be okay, but everybody around you is not going to be okay.
Yeah, I mean, a late decision in this thing is too costly. We've seen that around the world, and we've seen the imagery. Some people feel it's propaganda, but the reality is making the wrong decision in this time is really going to be very, 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 very expensive. So obviously with Breedemed, you're a private practice and you deal obviously a lot with the private industry and so on and so forth. Do you feel like the state environment are ready to handle the curve?
A word that comes to mind for me during this whole thing is unprecedented. We don't know what it's going to look like. So I don't really know what ready means. We've got marvelous doctors in the state. I think our government's been doing a fantastic job. The way the president's been communicating has been excellent. The NICD has been great. Just my experience of working with them has been great and communicating with them. We're in conversation with the Langeberg sub-district managers and doctors all the time. We know the doctors from Robertson Hospital. I think the state's been doing marvelously well. To answer the question whether they're ready for it, well, I don't even think private's really ready for it in that sense. You can't be ready for what you don't really know, how it's going to be. And if you look at how the first world countries are struggling, it would be folly to think that in South Africa it's going to go better if we have that kind of outbreak. Everything's being done by the government in a very good and organized way, and also in private. Everybody seems to be working together as well as, that could happen. Resource-wise, we need to be realistic. We have less than people have in America and Italy and the UK, and they're struggling there. So we might be in for some tough times in terms of that.
Once again, often we're in a situation, what can state or what can private do for me? I think we're really in a situation where everybody needs to really come together and say, what can we do to help out this situation? Because it really is in our hands. Don't go out, don't get infected. Go out, there's a chance you get infected and you can infect others. So I think there's a reason to do this massive lockdown. To lose billions within industry is not an easy decision. So quickly back to my previous question, and I just want to find out. So let's say, for you guys at Breedemed, what is the process? Someone feels that they're now a prime candidate for COVID-19. They've got the symptoms. What do they do?
It's very easy. Don't come to the practice. Phone the practice. Everybody's going to be treated in the same way, more or less. We'll talk about your risk. We'll talk about whether you need testing. We'll talk about whether you need testing, whether you just need a consultation and not testing. But you need to phone. That's the most important thing. Phone the practice and chat to us, and we'll be able to help you. We've been doing it for a number of days now, and it's going really smoothly. The most important thing is, let's say you won't be able to phone the practice, isolate yourself. You can't hurt anyone by isolating yourself for a day and then phoning us, for, let's say it's 8 o'clock at night, you don't want to phone now. Isolate yourself, phone us in the morning, and we'll take it from there.
So basically, I had the opportunity today. It was a real great conversation with someone, actually a doctor in the public sector. And we had a great conversation about, just how sort of the public sector is going to be handling, or how they currently handle, patients and the process. Now, again, because we're dealing with a pandemic, these things change constantly, and that's what they were saying, is that this is the current protocol and that may change. But I just thought it would be good to maybe read through what the state's protocol is. So the first thing is stay at home. I think that it cannot be any clearer in terms of what everybody is saying. Stay at home. Is make sure that your first point of call is not phoning the hospital. One of the things that they're inundated with phone calls, and that's not really the system that's been put in place. There's nothing wrong with phoning the hospital, but let that not be your first point of call. So if you feel unwell and are showing signs of having the coronavirus, then there are basically 3 options that you have. Number one is that there is a government WhatsApp group where you can obviously add that to your WhatsApp numbers. It's 0600 123 456. And obviously note that this is a bot. It's not real. But obviously it's been set up to help people through processes. So there's a list of sort of options that you have. If you'd like to receive news, if you'd like to receive stats, if you'd like to find out any news on the virus itself, and then obviously if you're showing symptoms. So that's a great first point of call. Second point of call, and this is actually been brilliantly received, and it works really, really well. These are legit, proper doctors that deal with you, and that is the COVID-19 hotline. So that's 0800 029 999 that you can give a shout, and that's a toll-free number, and you can chat to them about symptoms that you may have. And then the third option you have is obviously phoning a local number that we have, 021 928 4102. And again, these are all coming from the doctor within the state. So great advice. And then the third thing is, if you actually are not well, like you're really not well, and you're struggling to breathe, then you should do what you would normally do when you're struggling to breathe, and that's get to the hospital. Yeah. So it's quite simple. If you can't breathe and you're really showing signs, get yourself to the hospital. I've seen a couple of images floating around of this gigantic earbud, which the doctor sticks into your nose and down your throat to get mucus from the back of your throat. So my question is, why don't you just go into the throat? Why go through the nostril? Or is that true? Is there another option? Can you take blood? Because to be honest, and I know this, I'm trying to think which one's worse. I definitely don't want anybody to stick a giant earbud down my nose. So maybe you can take us through the process of what actually a test looks like and what people can expect.
Yeah, give me a moment. I'll fetch an earbud. All right. So testing, at this stage, we're not drawing blood. Okay, it's a different type of test. The way you get tested for the coronavirus is by, I wouldn't call it an ear, let's call it a swab into the back of your nose, okay, your nasopharynx, and then the back of your throat. We do both for everyone, okay? Obviously, it's a risk for everyone to get tested. You need to go to wherever you're going to be tested, either at the lab or at the hospital or the practice. It's actually not as bad as it sounds. Most people tolerate it fairly well. You might sneeze or cough a little bit. And I'm going to show you the swabs, okay? And I don't know if you can see it properly. There you go. That there, oh, my finger, it's small. That's the tip of it. That's the one that's going to go into your nose, all right? So it's really tiny. In comparison, that's an earbud.
I feel like you're not showing us how big that other one is. Can you lift that other one up? I need to see how long that thing is. Okay.
Okay, but the whole thing doesn't go in. Don't worry.
Okay.
The whole thing doesn't go in. It's so that I can stand far away enough to do it. That's not true. So, I mean, it's not really a big thing. You don't need to be scared about it. Okay. And it's much smaller than an earbud. Okay, so that goes into your nose and it goes into this little bottle. Okay, it's broken off. And then after that, we do one for your throat. Okay, so we just swab on your tonsils and the back of your throat. That's standard protocol to do both now for coronavirus. We need to actually catch some virus. That's the thing. We need to get some virus. It's not as if, so you need to make sure you got a good sample. That gets sent off to the lab, depending on where you are. That'll be, it'll be put on ice or kept cool, and it'll be sent via courier and tested generally 2 to 5 days. That they do test more serious cases, more urgent cases, but the labs can talk about that.
So a little bit of a side thing here, and maybe not a question, and maybe it does lead to a question, but I think we're surrounded by fake news. I don't know if you've seen it yourself, but I've definitely seen that a lot of information out there is absolutely fake. I don't know if you've seen that one with the dolphins in Venice. The dolphins are returning. They've never swum in the Venice channels or the channels itself, and now the dolphins are back because there's no boats, and that's fake news. There was this post about the president of Italy with tears running down his face, asking for the people to please, stay home. And it turned out that it wasn't even the president of Italy, it was the president of Brazil. And actually, if you look at the image in the background, it says Brazil. So there's just so much fake stuff going around. And something that's affected us on a local community is some people are posting things like so-and-so have got the virus and they work at, such and such a place. And then that really drastically affects the community, this fake news. What do you advise people? To me, don't read everything and make sure that the stuff is legit. But in your professional opinion, how do we stay away from this fake news situation?
I kind of wonder why people want to know exactly, as much as they can. So it's okay. You can go read. It's good to read. But I think, fortunately and unfortunately for us, the answers about coronavirus in terms of what you can do that's really effective are really simple answers. Stay at home. Wash your hands regularly with soap and water for 20 seconds. Don't touch your face. Practice social distancing. And maybe sometimes people want like some sort of miracle cure. So you've got things going around about hydroxychloroquine, and you've got things going around about azithromycin. And maybe if you stand in your head in moonlight and you eat a malvablaadjie, then you'll be cured. And maybe that is the cure. We don't know. But the fact of the matter is, I think people kind of want a quick cure or a quick answer, or maybe there's some way I don't have to socially distance. You need to take the responsibility, do the simple things right, and that's what works. We know. Fake news comes from, I think, people grasping at straws sometimes. You need to go to reliable sources, know which are your reliable sources. And there's a bit of a difference, or there's a subset of fake news that I would actually just call gossip. It's plain old gossip. We've had it so many times at the practice here where we've been testing people and coming back from other countries, and most of them are testing negative. And then you test someone today, and tomorrow you'd hear someone saying, "Did you hear so and so's in ICU and they're having on a ventilator?" And I just spoke to the guy 2 hours ago, and he's doing fine. His sore throat's better. So people are spreading stories, and you can do a lot of damage at a local level. You can hurt businesses. You can hurt just people. Actually, I don't think there's much to gain about it. If someone's going to have coronavirus and you're a contact, you will know about it. If someone tests positive for coronavirus, they will not be walking around on the streets. There's no way. They won't be allowed to, even if they want to. And so I think there's no point in spreading these rumors. You're not going to help anyone. Do the simple things right. Stay at home. Wash your hands with soap and water for 20 seconds. Don't touch your face. These are the simple things, So that's what I have to say about fake news.
I think people have to be staying on the moon not to know those 4 things. I mean, it's everywhere. It's on everything. Stay at home, wash your hands, Absolutely. Don't touch your face, and practice. We like to say physical distancing than social distancing, because we can still be pretty social online. But yeah, I agree 100%. Extra questions. A lot of these questions actually came from groups, and I actually want to mention that is that there's Facebook groups that have sort of reached out and contacted us as well and said, can you ask these questions? Here's a few extra things, and I think they also are desperately trying to sift through all the false information and only post the legit stuff. I think it's great. And I think it's something we all need to do on our platforms. Do not share stuff you do not know. Don't try and create an environment of just getting more likes and more interaction and it does not help anybody, and it really brings confusion. So that's something we are really trying to do as well. One of the questions is will people's names be made public if they have the virus?
If they have the virus? Well, I think we spoke about this earlier. We're at 1,300 cases now, roundabout. Do you know all the names? The answer is no, you don't, because that's patient confidentiality. If you're a close contact, you will be contacted. we know Angus Bachan's got it because he shared it with us. He told us. So that's something different, trying to destigmatize it. But no, your name won't be made public if it's a basic confidentiality of a patient.
So a little bit more personal, zooming down to you, and that's something that we also want to focus on this channel. I think we've shared a lot of information, a lot of things, but how has this affected you and your family? We all get to sort of experience this lockdown and stay safe and sort of look after our own home. And you, together with a group of people, those in sort of food industry and in our area, in the farming industry and so many areas, people have to go out and still be in the environment of being exposed. But you are really like people coming to see you that have the actual, or have potentially have COVID-19. How's this affected you and your family?
Yeah, it's definitely challenging. I've recently chatted to friends of mine, colleagues. It's definitely affected us in a way. I've got a little ritual. When I stop working, at the end of the day, I switch my clothes. I need to do a fair bit of washing. I put my keys, house keys, and things like that in a little Ziploc bag that stays clean. I know that bag's clean. All kind of trying to protect the exposure. When I go back home, certain shoes stay in the car. I only drive with this car. Nobody else drives with that car. I get home, no hugs and kisses. My clothes goes straight into the washing machine. I go straight into the shower. I wash my glasses. And then, obviously you've got it in the back of your mind, who are you exposing all the time? And I think, you're thinking about at some stage, if it becomes rife in our area and you're treating known positive cases, would you consider moving out of your house? I think that's a big reality. Yeah, it creates anxiety. On a personal level, my wife's pregnant. Lord willing, we'll have a little girl born soon in 4 or 5 weeks' time. Yeah, so you're thinking about that. Am I going to be there for the birth of my child? What's the hospital? Is it going to be a hospital space for her to go in for the delivery? So on a personal level, it's affecting us, and all the doctors are thinking about it. Doctors who have kids, doctors who themselves are a bit older, family living with them. It's all part of the consideration. So, and not only doctors, you have to think. I'm thinking of our practice. We've got admin staff, we've got receptionists. They basically healthcare workers in a sense. They're receiving people. They also need to be trained in gloves and masks and things like that. So, the personal burden on healthcare workers and people on the front line is a definite one. And I think we'll have to see how bad it gets, but we're a bit antsy sometimes about it. I must be honest.
Yeah, I think we again, us at home, we maybe don't understand, and we're a lot of introspective looking at how this thing is affecting us. But I think I think everyone out there, it's a great big massive thank you. And just the support from our side, which again leads me to my last question. How can we as a community support the local doctors, whether state, whether private, whether, how can we as a community, and I don't want to answer this myself, probably the answer is stay at home, wash your hands, don't touch your face, and physically distance yourself. But how
was going to be my first answer.
How can we as a community support the health system within our community?
Yeah. Mona, you've mentioned the first couple of things. Stay at home, wash your hands, protect yourself. Don't spread fake news. Refer people to proper websites. We'll be posting, on our Facebook page. You've been posting stuff, sacoronavirus.co.za. Excellent website, updated regularly. You can look at the WHO stuff, but I think the coronavirus website is everything you really need to know, whether you tested negative, tested positive, what the symptoms, you want to know about social distancing. It's all up on there, so that's great. I think, if you've got healthcare workers, or even, someone who you won't deem a healthcare worker, but someone who cleans at the hospital, they're healthcare workers, someone who works in the kitchen at the hospital, they're healthcare workers, they're in the front line. You mentioned so well that we don't want to socially distance, but we want to physically distance. Well, reach out to those people. A thank you here, or, we're thinking of you, we're praying for you. And gratitude is just a great way. It really, really puts a little bit of extra energy in. I think take care of the elderly in your area. It's really important. Take care of those at risk. And I think this is, if you look at the political parties, I don't want to talk politics, but have you ever seen the political parties agree and comply and, stand together in such a way? I haven't seen that. That's across the board, nobody's fighting. That has to make you realize that this is a time to comply, follow the rules, and you're gonna be doing everybody a favor. And I think that's would be my biggest message: just do those basic things, and we stand the best chance of flattening our curve, is making it as flat as we can. And then pray for us. We need it.
So thank you for answering the questions. I'm sure we'll have a recap catch-up call at a later stage. We've got some great guests coming up to chat to, and just looking at in different fields and how we can help people. So again, thank you so much for your time.
Thanks, Morne. Absolute pleasure to chat to you. I hope some of the information has been helpful to everyone. Thank you for your initiative here. I think the community could really do with just staying connected, and I think this is a great initiative. So where we can help with that, let us know, and hopefully we'll chat soon again, and it'll be a brighter outlook at that stage.
Just out of interest, you've given us roughly about an hour of your time. What would that cost?
Oh, Morne, for you, I'll have to work out a special rate. I think maybe we'll put it down as community service.
Well, thank you everybody for just taking the time to although this was quite a lengthy group of information and tons of stuff that we worked through. I think these are good things for us to really discuss and understand. There's so many times we're reading so much information that's not really, it doesn't help us. We get filled with so much information, so much negativity, so much, and the reality is death is negative, or we see it as negative, and it is a challenge, and something we don't understand, and something we'd like to get our hands around and grip on. And so it's so good to talk to people within the industry which really understand what is going on the forefront, that we can, we can't change our outside circumstances, but we can definitely stay at home. We can wash our hands. We can try our best to not touch our face. And then we can physically distance ourselves from others, because that's how we're going to win this battle. So those are the things we can focus on. So again, tune in for our next one. It's going to be great. We're going to be talking to some shop owners here in the local community, how COVID-19 has affected them, and also the limitations that they're under. There's so many people that give them so much advice that's just not in their ability to do, and they're also restricted. So it's going to be great to chat to them and find out how they're handling COVID-19. So thank you for taking the time, and we'll see you next time.